Hi Biophore, and welcome to part 5 of vessels, and we're moving on now from the capillary bed over to the veins. So veins, you know, are collecting blood. They're collecting blood from the tissues, and it's deoxygenated, and they're returning it to the right side of the heart. When you look at these veins, you notice that the walls are much thinner than that of the arteries. They have less muscle in them, but they tend to be larger in diameter when we see them in the cadaver because they kind of get floppy and they don't have that pressure in them. They just sort of flatten out. So they look larger, but they're really flimsier. That's the best word. So these veins are not under the same pressure that an artery is, so they don't need to have that thickness of the walls. They're not under that constant pressure coming at it 120 millimeters of mercury from the heart. So they're kind of collapsed when they're empty. A venule, of course, is a little vein, and these are much smaller. And many of these veins need to contain a valve, because think of what's happening. You have veins in your feet, right? And that blood has to make it all the way back up to your right atrium. And it's got to move up against gravity. So if it's moving up against gravity, that's a hard job to do, especially if you don't have a whole lot of muscle in the lining. So many of these veins, what they have are valves in them, and they're going to prevent that blood from just sort of pooling in your toes, right, and not making it all the way up. So they prevent that backflow, and the skeletal muscle is going to, what happens is that they're situated between skeletal muscle, right? Between your own regular leg muscles. So those leg muscles, when they contract, just because they're running or walking or exercising, they are going to squeeze those veins and aid, they're going to help that return of that blood back to the right side of the heart. So let's look at some pictures here. This is when you would have a contracted skeletal muscle, right? Because you're walking or jumping or whatever you're doing, and it's going to squeeze that vein that travels between a muscle and make blood sort of scoop back up into the right atrium. This is when that muscle gets relaxed. It's not exerting any pressure, and it's less likely that that blood is going to flow up, and it's just going to sort of pool. But luckily those valves are there, so if it gets beyond this valve, it's not going to go back down to your toes. And then on the next squeeze, it's going to get beyond this valve, and it'll continue up, going that way up towards the heart. And in no place is it going to just be able to flop all the way down to your ankles again. Now, sometimes that doesn't work very well. And in the event of, fragile valves, what could happen is the pooling of the blood inside those vessels. And when it starts to pool, then you see it like this in a leg. You see it as varicose veins. It's mostly happening in the more superficial ones. And a common example of this, when this happens, is during pregnancy. A mom will put on 30 pounds, 40 pounds, and there's a lot of pressure on those veins to move more fluid, more blood, and sometimes those valves are sort of overwhelmed, and you get some of these varicose veins that will go away, of course, once the baby's born. Another interesting thing are hemorrhoids. Hemorrhoids really are a varicose vein. That's all it is. It's a varicose vein, but of the anal canal. So if the varicose vein has, a problem of pooling, and it doesn't have a little valve there that can move blood, and they end up expanding, then you have these protrusions that can actually protrude out through the anal canal or within the canal. Within the canal, you wouldn't notice it, but you could have some bleeding in these, if, with pressure here, while having a bowel movement, for example. Could create pressure and have them bleed. So that's what a hemorrhoid is. It's a varicose vein of the anal canal. Let's look at some of these veins that you need to learn. And here, it's way too many more than you need to know. So I want to be able to limit some of these and show you more limited number that you will have in your lab and that you'll be learning, but let's take a look at them. The nice thing about the veins in the chest here is that they are symmetrical, unlike the arteries. So if you have a superior vena cava that's draining into the right side of the heart, you're going to have draining from the right arm and from the left arm. And those are going to be, once the arm and the head drain together, is going to be a brachiocephalic vein because it's coming both from the arm and from the head. So that region there would be right brachiocephalic, correct? And on the other side too, left brachiocephalic. So here it's symmetrical. Now coming, up from the head, because you're draining blood down in this direction, is the internal jugular. This is the internal jugular vein. It's the larger one of the two. This is one we see more easily. Another internal jugular vein. So that's head. And then from the arm, this is no different from the arteries. You're going to have a subclavian vein, axillary vein, and brachial vein. And the same on the other side. Okay, so both of these coming up superior vena cava, and then of course inferior vena cava. Nice. Here they are again. You can see it with the whole body. So draining from the head, internal jugular, and then they're coming, under the clavicle here, subclavian, and then this region here is brachiocephalic, as is this one, brachiocephalic vein, and then draining into the right atrium. Good. And then if we come down here, I've put arrows in those that you'll need to know for lab. So this is no different here. You have your renal vein, very similar to the renal artery, which is under the renal vein actually. It's deep too. And then you have common iliac, internal iliac, and external iliac veins. So those names are exactly the same. When it comes to the gonadal, those that either go here, gonadals, those that are going to the testicle or to the ovary, it's an interesting thing because the right one comes off of the inferior vena cava, but the left one actually comes off, I'm going to sneeze, comes off the renal artery, the left renal artery. So there is a lack of symmetry there. That's interesting. So you can see it here better. And you have the renal veins, and this is the testicular or ovarian, and this is the testicular or ovarian. And then the branching of the iliac, common iliac, internal iliac, external iliac vein. And those are the only ones you need to know, fewer than the arteries. Great. Just a few more slides I wanted to show you on atherosclerosis. Atherosclerosis is the buildup of lipids under the endothelium. Do you notice this is endothelium here? Look, I'm going to continue on going. And so the endothelium is there, and it's the accumulation under the endothelium. On the other side, you'd have it like this. And the earliest onset can be right before age 10, which is crazy, the first decade. And you could have some fatty streak, which is just some lipid accumulation, tiny bit. But you can see how over the years it could go increasing and deposit lots of lipid under there. And it would change names. It'd be called an atheroma. Once you have this large accumulation of lipid, and then a fibroatheroma when it's calcified. So if we have calcium that ends up in here and it becomes hardened, then it would be a fibroatheroma. atheroma. And then if it were actually going to rupture, if we had rupturing here, then it would be a complicated lesion. So this is accumulation of cholesterol, plaque, under the endothelium of an artery. Very complicated when it's on the arteries that irrigate the heart itself. Here in another diagram, you can see how, this should have been like this, open, and instead we have lots of lipid deposit there. And here you're seeing it also, this width of deposit in the walls of the arteries. And of course, this diminishes blood flow, and increases blood pressure. The last few slides are for you to just practice. They're for you to look at, and we're going to end this chapter right here with atherosclerosis. So thanks for listening, everyone.